Welcome to a little half hour to an hour on pet first aid and what we're going to do here. If there's any questions along the way, please don't hesitate to call, but we will have a question and answer session at the end. Now this is Bert. Bert is a 5-month-old golden retriever, okay, not a golden Labrador as the Express said the other week. If anyone saw about pet first aid in the Express or anything, you may have seen Bert in there. Now, biggest thing you'll see with Bert, even for a 5-month-old, he's very, very easy to touch. 2 reasons for that is the first reason, I need to be able to make sure that he's good with people, with other animals, etc., and feel comfortable. The second reason is if we can train them very young to be able to look at the signs and symptoms of illness, then obviously we're going to benefit. Now, whenever you buy a puppy, one of the first things to look at is in the mouth. One of the reasons up the top part of the mouth is their cleft and their palate. Now, one of the things that some puppies suffer with, and anyone breeds will know, is some animals suffer with what's known as a cleft palate. Now, a cleft palate, you would normally tell this would be on a line, have a line going down there, and unfortunately the dog will normally drown in his own saliva. The next thing we're looking at with Bert, even though Bert is now teething at the moment, as you can see his young puppy teeth here, we're looking at the colour of the gums, because the colour of the gums is such a huge sign of what happens within an animal and how an animal is feeling. Each gum is slightly different in each animal. So you want to be able to get the dog comfortable with letting you have a look inside its mouth and understanding how the mouth works and what colour your dog is. If he is ill, then obviously this colour will change and you can recognise the signs and symptoms of illness. The next thing to look at is his nose. And one thing with his nose, it's very moist, and if I wipe it, it's very moist again, okay? Next thing, with long-haired animals, long-eared dogs especially, what you'll find is that they are prone to what's known as ear mites. Normally the way of telling, you'll see with Bert's ears, they're very, very clear. Bert actually did suffer with ear mites before. And one of the biggest aspects of it is you will notice a brown marking in there, and if you get tissue and clean it out, that's what's left of the ear mites as they live in the ear. It's very easy to treat. 6 weeks worth of symptoms will normally do it. Of treatment will normally make it work. Normally, if you see any dirt inside the dog's ear, it will be a brown tar. And if you get a tissue or a piece of cotton wool and just brush it out, you'll normally find some dead ear mites in it. Take him straight to the vet, get it checked out. This first aid, once again, anyone done a human first aid? We've got a few. Who's got kids? Who didn't put their hands up on the first one? Yeah? We do first aid for animals, but it's quite funny that we don't do it first aid for our children, isn't it? Yeah? So the big aspect is, it's the same principle as first aid on humans. We want to make the dog or the cat or the tortoise or whatever animal alive to get it to the vet. And also, this is very much about your safety. Now, Bert is very relaxed, as you can see, and one of the things that we need to get him used to doing is checking his tail, checking his paws. Now, I normally mouth me in this, because even now he still doesn't like it, but you'll see he's quite comfortable with it, and if he doesn't bite me, he bites him, yeah? So, well done, Bert. And you can go through all of his paws, you can go through absolutely everything, and he thinks I'm starting to play with him, and he doesn't particularly love it, but try not to tickle him, try and get in there, get him used to it, because that way, when there is an issue, and it can happen, then obviously we can get him used to. Now that's really not right in front of ladies, but still. Bert is very relaxed, and one of the things we can do with Bert, Bert will turn upside down when he's not feeling a bit uncomfortable, and he will let us do it. Do what we want and touch him in every area that we possibly can. Now, one of the biggest things with an animal's mouth, especially a dog's mouth, is the saliva is actually antiseptic. So when a dog licks its own wounds, that's fine, that's great. It actually helps and benefits. The one thing to realise though, there's more bacteria around his teeth than there are humans on this earth. Okay, so the mouth is at a very, very, very dangerous thing for infection control. So whenever you're touching a dog's mouth, you need to do two things, and I will wipe my hands afterwards with a Clinell antiseptic wipe, but I'll also recognise that I haven't got any cuts on my hands, because any pathogens in the saliva will go into my bloodstream and basically go around my body. Now that can cause quite a few problems, and a lot of younger children with puppies will get worms, and that's normally from dogs licking their mouths, licking their face. And the reason why a dog licks a person's face is it's asking for food. So when you've got a puppy or a dog licking you, that's what it's doing. It's its natural instinct. Because in the wild, the mother would regurgitate the food, and that's why it recognises it. The other thing to do, especially with a dog like this, especially with the feet so big, when he was a puppy, we didn't pick him up. And the reason we didn't pick him up was because if you get them used to coming up to your height, then as they get older, they're going to jump onto you. So it's very, very, very important that you keep the animal as calm as possible, get him used to you touching and feeling, check him for dehydration by pulling the skin. Now this is a big sign, he's very well hydrated because the skin goes back into form and there's a lot of movement on the back. So always check your dog for that. Even on tight skinned dogs like staffies and things like that, there will be movement in the skin. Dehydration, especially in this country, is quite a big killer because people do decide to take their dogs in cars. Who's bought their dog today? Excellent. Anyone left their dog in the car? Fantastic, good answer. The RSPCA are very, very prone because it takes 20 minutes to cook an animal in a car, even with the windows open. Now, an RSPCA person cannot smash a car window. They do not have the rights to do that. But what they do have is the ability to phone the police in exactly the same way as you do, and the police will normally smash the window to get the animal out. And we all have a duty of care to our animals and other people's who have been silly enough to leave their dogs there. Now I'm going to take Bert back to Claire because we like to only give him a couple of minutes. And one of the big things to remember with a puppy is short walks, only 15 minutes. Now one of the things with Bert, when he was hip scored, he had very, very good hips. But if I'd have taken him on long walks, what would have happened? The way a hip score works is that it's the joint going over the bone. So the more we walk them, he can smell his food, the more we walk them, the smaller that comes, and that can cause hip dysplasia in an animal. So when you've got a puppy, for the first 6 months, 15 minutes walks maximum. It's more about boredom, excitement. But Bert's going to go back. Now he's got the food. Can everyone give Bert a round of applause, please? Very good boy. Come on. Down you go. Okay. Now this dog's a little bit more obedient than Bert because of the fact he's made of plastic. Now I don't recommend you putting a tube up in the hole in the hind leg, but one of the reasons that I'm doing this is what I want to show you is where the dog's pulse is. Now, on an animal, basically we're going to give you some tips on CPR and show you how to do CPR on an animal. And anyone who's signed up for our course today, I'd like you to come up and actually do it. Now, with an animal, the biggest part is its structure is slightly different to a human body. In other words, a dog is not going to lay on its back when it's unconscious and let you give it chest compressions in that way. So what we're trying to do is bring the dog laying this way so the head's to the right. The reason for that will bring the heart up to here and also give us a very good opportunity to be able to do chest compressions on it. Now with a dog, the way to find a dog's pulse, how would you find a dog's pulse, ladies and gents? Come on. On the neck, on the armpit, on the leg. The actual right way is just under the leg here, hind legs, and you will feel the pulse. So I'm going to hand that round. If you just pop your hand under there.
I see, yeah.
Yeah?
Yeah, right.
It's not that exciting. Yeah? So the biggest part with a dog, can you feel it? Yeah? And anyone else who wants to feel the pulse will do that at the end, and anyone who's ordered the pet first aid, if we have 5 minutes at the end and we'll go through that. Now the reason we need to know the heart, where the heart is because of CPR. A dog's heart is exactly the same as a human's heart. CPR will not start a human heart. If the heart has stopped, the only way of restarting it is with an automated electronic defibrillator. That's where you put the shocks on and you shock it and stand back, yeah? And it's exactly the same with an animal. What CPR is to do is to recirculate oxygen into the body. So it's not going to start the heart. This is why it's very important that we check the pulse rate to make sure and ensure that the dog is alive. Now, when we're giving mouth to a dog, you're actually giving mouth to nose to your animal. So when your dog is unconscious, or your cat, or your hamster, or any other, and we have seen a koi carp that a guy picked out of the water, wrapped it in a cloth, gave it a couple of chest compressions and breathed into its nose, and it swam off and is still alive today. So it is capable of doing it in any way. Now, most dogs don't come with a plastic bag, not on this end anyway. So this is for protection for me and for anyone else. Now the biggest part with a dog is that the tongue is extremely long, yeah? Now the tongue, this is why animals are so clever, especially dogs. When you give them medication, especially pills, you put it, they normally find it on the floor 5 seconds later, yeah? Who wraps it in cheese? Yeah? Ever had your dog choke? It's one of the worst things you can do. The reason being is, unfortunately, what happens is if their airways, if they're having an anaphylactic shock or something like that, then their airways will close. And you put a piece of cheese in there, and what you're actually doing is blocking the airways, and therefore you can potentially kill your animal. So the best way of doing it, at the back of a dog's mouth, you've got obviously no teeth. You've all seen that, and we can show you with Bert. If you get your hand in there, and the tongue will naturally come out trying to flick your fingers out of it. Open the mouth out and place at the back and keep your finger in the mouth at the back. The dog will naturally swallow the medication. Okay, so you want to keep it down, but putting it on a piece of cheese, unfortunately, that's not acceptable, and you shouldn't really do it. Now the next side of CPR is with a dog's mouth. So if this is a dog laying on the floor unconscious, before I even go up to it, what I'm going to do is check my own safety. So I'm going to make sure, did anyone see on the TV the other week a couple of horses walking around a rink, and unfortunately they went across an electric cable and were electrocuted and died? Same principle with an animal. Protect yourself. Because if you walk up to him and he is unfortunately electrocuted, what's going to happen to you? You're going to be electrocuted. No one can save both of you. So therefore we're going to make sure the electric is off, that there's no gas and that there's no harm to us and the environment is right. The next thing we're going to do is check the dog's pulse, or the cat's pulse, or the hamster's, or whatever. It's all in the same location. We're then going to look at the mouth. Now the biggest part is we cannot, especially with Bert-sized dogs, get our mouth all the way around here and get an avenue where we can breathe into quite comfortably. So with an animal, you're going to do what's known as nose to mouth resuscitation. So it's his nose, your mouth, okay? And to do that, what we need to do is basically close the mouth, because if we breathe into the nose and you haven't closed the mouth, unfortunately it's going to come straight out of the mouth because it's linked. So we're going to take the tongue to one side and close the mouth like that. That then gives us a very good passageway to being able to do compressions and mouths and breaths. And what we're going to do, we're going to look at the dog, we're going to check its pulse and make sure that the heart is still going. If the heart isn't going, there is no point in doing that and trying to smack it. There's no point in compression. Get it to the vet as soon as possible, but you need the vet to be very close to be able to survive. So what we're going to do, we're going to pull the tongue to one side, we're going to close the mouth, and we're going to give it 2 breaths. So now you breathe quite hard into a dog's nose to get the breath into it. Now it's very, very important that, especially with a dog that is drowned or something like that, that you get 2 breaths into it. And the reason for that is the water, and in fresh water it thins the blood, in salt water it thickens the blood. And what we need to do is get 2 breaths in there to give us a chance of making that animal survive. Once you've got 2 breaths in, all put your hands out like that. Everyone put their hands out like you're diving, yeah, with your hands. And what you're trying to do is you're trying to get pressure there and there. So put your hands out and put above the animal, so you're diving. But you're actually pushing with your shoulders and not with your wrists. So you're pushing down on the animal, and we're going to do 15 compressions. So count with me. 1, 2, 3, can't hear you.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Now the reason we count while we're doing it is 2 reasons. Firstly, we want to know how many we've done, but secondly, it will calm you down. If you don't, it's all in your head and all your feelings are in your head. We want to calm ourselves down and make sure that we're doing it correctly. So once you've done your 15 compressions, with what you're trying to do, you're trying to get the air. How it works is a very similar way to a bag being blown up. So if you had a bottle in a bath and you squeeze that empty bottle, the air comes out and the water comes out. When you release that bottle, the air's drawn back into it, isn't it? Yeah? And it's the same principle with the lung. You compress in the lung, and then when you let go, it expands again. So what you're trying to do ideally is to get between 2 and 3 centimetre depth. You will not it's very difficult to break the dog's rib, and the only danger that you have is if you do break a dog's rib, potentially you could get a further complication with a punctured lung. But it's very, very difficult to do that. And therefore, by putting your weight on it and actually compressing, then that's fine. Obviously, with a hamster, I don't recommend that. It's 2 fingers in the same way you would a child. So with an adult, it would be exactly the same. Arms out in front of you, dive, use your shoulders, and you're trying to get a depth of between 2 to 5 centimetres.
Where will you draw the line then from the 2 fingers of the hand on the size of the dog, like
A miniature Yorkie, it depends on the dog. You can do one-handed. A lot of people and vets will say do one-handed on a dog. So it's a bit of control on your side, but the biggest part is to get those compressions in, because that way you'll circulate the air into the lungs, from the lungs into the bloodstream. Now obviously on a dog this size, it's sort of Springer Spaniel size, I would be going 2 arms and trying to get a depth of between 2 to 5 centimetres if possible. So I'm making sure those lungs are closing and opening. Once I've done that, I'm going to go straight back to my breaths, and I'm going to put another 2 breaths in. And then back again, compressions. Now one of the difficulties is, what if the animal wakes up while you're doing it? Because potentially that can happen. So what you need to be aware of is how to restrain a dog from biting you while you're doing it, or once you've done it. So the way to do that is to put your arm across from the front leg to the hind leg like that, and then your arm across again. That way, if the dog's trying to bite you, you can put your elbow in the way and stop his head from moving and attacking you. Yeah? So therefore, it makes quite a nice base to work on and to be able to protect yourself at all times. Now by holding it down, you're not doing any damage to the dog. In fact, if I got Bert back up here and did this to him, he'd be quite relaxed about it. But what you would see is he wouldn't be able to turn around and bite me, because potentially that's a life-threatening thing for me. So we've now done compressions. Is there any questions on CPR on a dog? Anyone? No? Everyone think they can do it? Into his nose. Then what you would do, because you've got your hand there, is go like that, quick as possible, yeah? Very, very good technique that. It saves your face. But in most cases, the dog will come around on the compressions. But it's going to have a slow, and it depends what is wrong with the dog and what's caused that injury. But hopefully if the dog comes around, then you can step back or you can just protect yourself. Now in a human, so you know how effective CPR is, CPR, the reason why human first aid is so important, if I gave human first aid to 100 people, how many would survive? Pick a number between 1 and 100. 50, lady at the back? 99 and 12. It's actually 2. Okay, so CPR is not a massively effective way of saving someone. But the reason why first aid on animals and on people is so important that you know CPR is, wouldn't it be nice to know that your animal or your children could be those too? So it's always worth knowing. Now, just for all of you who have got children who haven't been on a first aid course, with a human, it's 2 breaths to 30 compressions, 2 breaths to 30. Now, if the dog has drowned, okay, what you need to try and do is get additional oxygen in. So when you get it out of the water, try and put 5 breaths into the dog to 15 compressions, then 2, 15, 2, 15. So if a dog has drowned and you've taken it out of the water, it's 5 breaths, compressions, 2 breaths, compressions, okay? If the dog is vomited or it's a dog that you don't know, then just do compressions only unless it's been in water. If it's been in water, you must get breaths in. But even compressions will help that animal. And if you think you are at risk, just do compressions, sorry. The best way of getting a dog with water in it is to lift it and literally, it depends on the size of the dog. If it's a Great Dane, then you've got a problem. But as long as the hind legs are up and you're taking water out, then that's fantastic. Now, one of the biggest killers of pets in this country is actually shock. And the way you deal with shock is exactly the same way you would deal with a human on shock. If it was a human, what you would do is lift the legs up so that the blood is forced back to the heart. And it's the same principle with a dog. What you need to do is lift the hind legs up. Now put them onto a cushion or something to make sure and try and push the blood back to the heart and keep the blood flowing to the heart, gravity to take place. The other side of it is Heimlich maneuver and with a dog and trying to get a dog to stop choking and getting the food out of it. Part of our pet first aid course, I'm not going to give you everything today, but if you see us afterwards, we can show you and talk to you about that. Now, last thing I want to really discuss with you is animals by water. Who deals with animals by water? Do you all take your dogs out? Yeah, and there's always water around. In the winter, do you let your dogs off? Yeah? But could they potentially go into the water? Yeah? If you watch a police dog, they will always keep them on a long lead for 2 reasons. One, they can pull them off a criminal, but the second reason is because of the fact that if they go into water, you're not putting yourself at risk, because you go into the water and merrily try to save your dog. The dog thinks, well, hey, thank you, climbs on your shoulders, jumps out, and you're drowned. So potentially it's a life-threatening thing. We can go on. First aid in animals is very similar to human first aid in the fact that this is to maintain life until you can get your animal into a vet or medical first aid. So what we're trying to do is not do everything, take anything away from the vet. If you have to administer first aid, always get your animal to the vet. Part of our courses that we do with Pro Pet First Aid, and it's www.propet propetfirstaid.co.uk, is to teach you how to deal with bleeding, how to deal with paw issues, how to deal with young animals, older animals, fits, what to do how to restrain an animal in a car to get them to a vet. Because if your dog's running along and there's a rabbit hole and the hind leg goes in, it snaps its leg, what would you all do? Pick the dog and get to the vet. And the fantastic part is, where's your nearest vet from the fields you go to? Normally about 10, 15, 20 minutes. Now put that into rush hour traffic or 2 o'clock in the morning, and what are we going to have? So the situation is, when a dog has a broken limb of any way, shape or form, we need to transport it to the vet as quickly as possible. Now, does anyone have a board in the back of their car, what they call parcel shelf in the back of their car? Anyone drive a Golf or something like that? Yeah? Never thought. That can act as a stretcher, but if you actually put a cloth underneath it and wrap it over your animal, whether it's a cat or a dog, and wrap it all the way round, put it on the back seat, the weight of the dog will hold it down, and therefore it can't move. Because a fracture, if it's a brake and it's moving in the car, it's going to splinter, and that's why we get three-legged dogs. And who's got cats? You're the ones. Okay. The only thing with cats that you've got to be aware of, a cat is very similar to a dog in most ways, except the best way to transport them is in a box. But the worst part about a cat is its mouth. A dog's mouth and saliva is antiseptic. With a cat, it's septic. A cat will bite a rat. The rat may get away, but 90% of the time it will die. And it's the same principle with you. If a cat bites you or your animal, you must go to the doctors or the vet, because it has loads of pathogens in its blood. So you need to make sure that if a cat is licking your wound, get it off as soon as possible, because it's not good for you. We're going to leave it there, guys. Thank you very much. For those who have ordered and done the Pet First Aid course, if you want to come round, and we're going to let you have a go on CPR. If anyone is interested in the Pet First Aid course, please see Claire over there. And we do an online course, and we do face-to-face courses in Essex as well. So in Essex. And if you have a dog group, we will come out and do a dog group. We're going to Liverpool next week, so wherever you like. Normally about 12, and we charge £300, so it works out about £25 per person. All right. And if there's anything else anyone would like to know, please come and ask me. All right.